VIDA stands for Vision for Dignity, Access, and Accountability in Healthcare. And that is exactly the work that we do. Casa de Salud and VIDA are co-located in a small community building in the South Valley of Albuquerque, New Mexico. The South Valley of Albuquerque has significant disadvantages from a health perspective as compared to other parts of the county. There's generational trauma, there's generational poverty, there's a greater struggle with opiate addictions, there's more uninsured folks who have decreased access to care in general, there's fewer services here, as well as there's an almost 10-year decrease in life expectancy in some areas of the South Valley as compared to the rest of the county.
The primary barriers or challenges that this community faces have to do with the deep levels of poverty and exclusion in social sense, political sense, economic sense that people face here. Race plays a huge role in that in terms of the history of the place. The VIDA program here at Casa de Salud is an element of community engagement that is critical towards involving the community in broader efforts beyond day-to-day health care service delivery in achieving health equity by putting people in a position where they can actually feel more empowered when they're dealing with very powerful institutions that can make the decisions as to whether or not they get health care service delivery or not.
I'm a family physician and I was trained in social justice work and looking beyond the confines of an exam room. In my work, it doesn't feel fully rewarding. It doesn't feel like I'm doing my job if what I'm doing is just providing services in an exam room without a context of where this patient that I'm working with is in community, what their struggles are beyond their healthcare needs. The work that VIDA and Casa de Salud do together is incredibly rewarding because it allows myself, every single other clinician here, every staff member here, every one of our student health apprentices who work with us and then go on to healthcare and public health fields, it allows us the opportunity to really think out how we can affect patients' lives beyond the confines of a clinical setting, beyond the confines of a building where people come to get health care, and to have a consciousness that is so critical in medicine. It is our responsibility as healthcare workers, as frontline community health workers, as students, as public health professionals, to look at the structural issues that affect our community. And part of the role of Casa de Salud is saying, how can a clinic reroute itself in a community in a way that allows for that greater responsibility, that brings on team members who are leaders in this area and who are every day thinking about how can we affect people's lives in a greater way than what they come in to see me for in my clinical setting. Top to bottom, student health apprentices, to staff members, to clinicians, to our board of directors, is representative of the community and is specifically highlighting the work of women of color, immigrant families, bilingual native Spanish speakers, and others who are the future leaders of this work in our community. In the last 6 years, our VIDA team has directly impacted the lives of residents of Bernalillo County, the lives of those most impacted by not having health insurance, health access, by being marginalized by health systems. In the last 6 years alone, we've helped decrease the financial burden that our residents have had to pay in hospital bills and emergency room by $2 million. That's $2 million of overwhelming medical debt that our residents have been able to save, improving their financial health, improving their emotional health, the togetherness of their families, and their economic well-being. We at VIDA and Casa de Salud are honored to receive this 3-year funding from Alma Health Foundation.
I think sometimes what VIDA does is putting the voice for those people that don't have a voice or they think they don't have a voice. I think the hope, the vision, the empowerment that we are able to give to someone that was completely disconnected from reality and from our community, give him voice and make someone knows that they are worth the fight.